Imagine stressing and worrying over the most basic social interactions, such as saying hello to your neighbor or talking to someone on a cell phone. The distress from social interactions and the anxiety they create is social anxiety disorder. Someone with SAD gets extreme anxiety from social situations. It is the knowledge that they have a possibility of encountering a social situation that creates anxiety. The person associates fear to social situations. Anxiety would consume their thoughts, cause a racing heart, and make their palms sweat, have butterflies in the stomach, and even cause dizziness. This negative experience may sometimes be too overwhelming. Take a look at this list. People with SAD have an extreme and irrational fear of being judged and humiliated by others. This fear causes anxiety for every social situation because of uncertainty. The person afflicted is capable of performing the social interaction, but with great effort, and suffers from the anxiety it creates. It causes distress and impairs a person's life. Most people do not have social anxiety disorder or will not get it during their lifetime. According to Statistics Canada, 8% of the Canadian population aged 15 or over reported to have SAD. It is deviant. This chart gives a compressed cause and effect relationship on SAD. You should pause to read it. There are 3 vulnerabilities for developing social anxiety disorder, like other anxiety disorders. There should exist a biological vulnerability in the person that predisposes them to develop SAD, a genetic trait that is sensitive to criticism, an overactive amygdala, difficulties during childbirth, or a traumatic experience very early in life are all examples. A person will have a psychological vulnerability in order to have SAD. This includes his or her attribution style to scrutiny or ridicule. Personality traits like high neuroticism or low extroversion could be vulnerabilities. The last is a specific vulnerability that channels your anxiety to a certain aspect. For SAD, this vulnerability can be environmental. For example, the person was a kid with low social skills. Real life scenario. A college student withdraws from a course when she hears that she has to present in front of class for 10 minutes at the end of the course. Sadly, by dropping the course, she loses the opportunity of being in a team, making friends, sharpening her social skills, and loses time that could be spent on another course. Performance in school and performance in work drop because of SAD. Real life scenario. A teenager with SAD may skip classes to avoid extracurricular activities while dampening her success in her education. A shift supervisor may decline a department manager position because of the anxiety this job would create from working with a lot more people, stagnating his career. This has been an educational video clip on social anxiety disorder brought to you by the Psychology Department of Kwantlen Polytechnic University.